right, well, January is Thyroid Awareness Month, and according to the American Thyroid Association, an estimated 20 million Americans have some form of thyroid disease. But what are the ways to prevent it? We are going to bring in Dr. Osakwe, Chief of Endocrinology at Bay State Health. And Dr. Osakwe, can you just first kind of give us an overview of what thyroid disease is?
Oh, thank you for having me. So thyroid disease is really a plethora of medical problems related to the thyroid gland. The thyroid gland is a metabolic organ that produces hormone that regulates the whole of the thyroid. So there is a spectrum of thyroid diseases: hypothyroidism or underactive thyroid gland, hyperthyroidism or overactive thyroid gland. You also have nodular thyroid disease or thyroid nodules, which can be which can be identified with either a physical exam, but usually we would do an ultrasound to find it. And then we also have thyroid cancer. So these are sort of the more common thyroid diseases.
Okay, and so what are some of the symptoms that people can look out for, maybe some of the warning signs that maybe could trigger them to get tested for any of those things that you just mentioned?
So because the thyroid produces hormone that regulates the metabolism, you may experience more fatigue than usual, feel colder than usual, or find it more difficult to lose weight, or find that you're putting on weight. These are some of the symptoms that may suggest that you have an underactive thyroid gland or hypothyroidism. Occasionally, also, hair loss can be one of those presentations. On the other hand, you may find that you're more irritable, jittery, having more problems concentrating. You may find it difficult to go to sleep at night, or you may feel that your heart is racing or having palpitations. Those are indications that you may have an overactive thyroid gland and should be evaluated. And usually blood work is what you do.
Okay, and so once you get the blood work, what are some of the treatments that people usually see that can help treat the thyroid disease or thyroid disorders?
So treatment of thyroid disorder is usually, it's been around for years. Usually with underactive thyroid gland, just a pill that you would take. Your doctor will prescribe that pill to regulate your thyroid. And usually after starting it, about 6 weeks to 8 weeks later, they will recheck and make sure that the dose is appropriate. And it may take 2 or 3 adjustments to get you to the right dose. For an overactive thyroid gland, there are 3 ways to treat it. You can treat it with a pill which regulates the activity of the gland, or you can treat it with the radioactive iodine pill, which kills off the thyroid, in which case it treats your hyperthyroidism, then you take thyroid pills to supplement the hormone. Or you can also have surgery for the treatment of hyperthyroidism.
We appreciate all of your time. Thank you so much, and thanks for joining us.
Oh, it was my pleasure.
Thank you.